controls and how to incorporate negative air, and basically what's next with the pandemic and how we're going to be able to get hopefully ahead of it. So to start off with, the Journal of American Dental Association just released in June a really preliminary study on the estimated number of US dentists who tested positive, COVID positive in the early months of the pandemic. I honestly think that us as dentists, there is a high incidence of us with risk as to basically getting positive in terms of getting COVID positive. And this is really driven by obviously behavior. As dentists, we are in a very high risk field and there's not much that we can do, but we need to make sure that we are presenting ourselves, our staff and our patients with the safest possible environment. We're always close to our patients. We don't know some of the patients are positive or not, as you know as well as I do, that they are asymptomatic COVID positive patients. Also, how long are we there for? Now, if you can imagine as a dentist, you're working, the whole day, 3 to 4 times a week. Well, you know what? Your length of exposure that you're doing during this infectious period, because you don't know who's infectious or not, can add up as time goes on. This really is the biggest thing that I want to highlight. And every time that I do a presentation, I always learn something. And today, this is something that I learned, is that it's really important for us that we are actually exposing ourselves during this time. So it's really important for us to have protective measures. And more important than that, it's the environmental factors, or the air and the airflow characteristics really need to be on top of that as we're treating our patients. So just let's quickly review our risk factors for contracting COVID-19 as dentists. What kind of procedures are we performing? Are we performing aerosol or non-aerosol procedures? How often are we performing these procedures? And of course, most importantly, what is the community level of transmission around us? In Ontario right now, it's quite high. I think you're looking at about, it's about 4%. And if you, in Peel, for instance, if you're looking at about, I think it's about 200 or 300 patients, 70 of those may be positive. And if that means that you have a 50% chance of getting a patient and getting yourself being exposed to the COVID virus. So it's really important for us to be on top of our engineering controls. And that is one of the things that I think that we are really lacking. We've absolutely applied our hierarchy of controls, which I'll get back to. We'll talk about how PPE is so important, but more than anything, it's the engineering controls in our office that I think that we really need to focus upon. Today, that's what we're really gonna target. The last thing, which is also something that's very overlooked, because we're in a dental office, because we always work with our staff, we're also basically increasing our bubble. And unfortunately, yourself or your staff sometimes have, habits that may get us to be exposed, or may have your patients being exposed because one of the team is positive. So that's one of the other really big risk factors that's important. If we have good environmental flow factors, it's very important. So there's a lot of controversy in the key points to understand COVID transmission. So I really want to spend the first few minutes of the presentation on that. There's a lot of controversy. There's also a lot of, someone like the WHO, the CDC, they took a very long time to finally acknowledge that COVID-19 transmission is an aerosol-based transmission. So there are 3 ways that COVID-19 is transmitted. One is through large droplets, and that is the direct spray route or the indirect contact route. You also have the small droplets, which are 5 microns or less. Now, here's the funny thing. Aerosol science has advanced so much, but these classifications, less than 5 millimeters, was just picked out arbitrarily. There is no reason why. All that I do know is that when I speak, I am releasing a lot of aerosols. So it's not that it's large droplets, it's mostly aerosol driven that we have to be concerned about. And of course, the last route is the fomite route, is basically any contaminated surfaces. And that's kind of debatable whether or not it's that important or not. So if we do think and we do understand that COVID-19 transmission is through large droplets, you're looking at the droplets having a very quick fall off, and you're looking at about 5 feet around you if you're with somebody or if you're treating somebody. Now, it gets really tricky because as aerosol driven, now you worry it's a much more longer range of distance. And the also important thing to also understand is not only is it a longer range of distance, but now you can transport the virus to other places in the dental office. So that's really what we're going to focus upon. So once again, I want to make sure we have the direct contact route, we have the large droplet spray, we have the indirect contact, and we have the aerosols. And of course, the aerosols is something that we're going to be most concerned about today, because that's something that I think we're really lacking on. As dentists, we're very close to our patients. So obviously the direct contact, we always have to be aware of that. The large droplet spray, we have our vacuum, high volume vacuum that we're using, which is working very well. Once the patient is left, we're also very good in indirect contact removal with many of the things that we have from surface disinfection. I think the aerosols, once again, I'm trying to make this a big point, is where we really need to get our game up. So if you're looking from a high exposure, we as dentists, dental assistants have a very high exposure, and that's simply because, number one, we're very close to our patients. Two, obviously they're not wearing a mask because we need to work on them, and that's also the important thing. And number three, because we're generating aerosols, we as dentists are actually increasing the viral aerosol load in that room. So if you look at most of our infection control that we're doing, almost all of it is based on droplet transmission. So as dentists, we've been great. You know, PPE, we're getting our gowns on, got our face shields on, got our N95 respirator mask, and doing really well. However, that's only really for droplets. We have not even touched the surface of aerosols. So with aerosols, when we are treating our patients, regardless of whether we're even doing aerosol generating procedures, just by them speaking, they're basically releasing aerosol, and in multiple, numerous sizes. So this is something that's really important. And the only way that we can take care of this is through ventilation, where we dilute the virus concentration to a low level. So I want to emphasize this because I want to make sure, because I have lots of friends who are dentists and they always tell me, yeah, Dill, I'm doing fine, I'm taking care of it, but we're not. We're really close to our patients. And I kind of wanted to show this video because it's really important. As a patient, this is what you're seeing. And almost all our infection control procedures have been based on the droplet transmission. They're not aerosol based. So a lot of my friends tell me, you know what, I'm fine. I'm following guidelines. I'm following recommendations. I'm fine. You know what? It's not good enough. So what do we do about that? So before I move forward, I know there's a lot of people out there who say to me, prove me it's aerosol based. Prove me, show me the studies. So that's what we're going to do with the next couple of slides. These are obviously researched. You can see all the articles are listed down there. I also took this from Jay Butler presentation. He's a CDC scientist, and basically there were cases of SARS in a high-rise building in Hong Kong, and they basically were aerosol transmitted. The next thing is the choir practice. This choir practice occurred, and unfortunately, it was so sad to hear this story where 53 of the people at the choir actually got symptoms of COVID-19, and 3 were hospitalized and 2 died. So I remember reading this article in the paper, and my heart just broke when I heard this poor person who organized this choir practice, because it was droplet based. Well, guess what? It's not droplet based. It's aerosol based. And of course, the last one that I always think about is the one in the restaurant. And what happened here is a family from Wuhan had lunch on January 24th in the restaurant. They're all seated at adjacent tables. No one else in the restaurant got sick or got anything. The only people who got sick, unfortunately, were sitting in that flow of the AC vent as the AC unit was being turned on. So what happened here was the people, you can see the purple person right here, that person transmitted to 5 others to the adjacent table right here. And basically, it's now pretty much a concern that at that time, we weren't sure whether it was aerosol-based, droplet-based, but this should now alleviate any concerns that you may have that it's aerosol-based. So the most important thing, again, and I'll again put this video, is all our infection control procedures need to be on, we need to be on guard. We need to really step our game up. It is not droplet transmission, but it's actually aerosol-based. So now what do we do? Now, the other thing that's really important is in dentistry, we're actually not only have our patients open with our mouths, they're basically contaminating the room with their potential aerosols. With any kind of drilling, as soon as they open their mouth, guess what we're doing? We're increasing our biological risk as we're generating aerosol contaminants. I don't think this is something that we should really not worry about. It is worrisome because remember what I talked about. We're increasing our biological risk. So let's talk about how to remove this virus in indoor air. So the way we do this is we have ventilation. And through ventilation, a lot of the virus is going to be removed. We're going to talk about how and the different kinds of ventilation that we have. Some of the virus is going to be inactivated. And of course, some of the virus is going to settle. So what are the environmental that we have to have the virus settle? A lot of this is also dependent on humidity. I think that really has to be our hidden gem as dentists, because we're basically producing an aerosol. And the reason why we're producing an aerosol most of the time is because we're using water in our air water syringes, or water in our handpieces, or water in our ultrasonic scalers if we're using them. And basically we're increasing the humidity of the room. I really think that's really what's really helping us out right now, because that is the reason why we've got such a great track record when it comes to making sure that our patients are safe. But of course, this is something that has happened. I don't think we've done this purposely. And what I would like us to do, I'd like us to be safe for the next number of years. I don't want us to take things by chance. So it's great that we have increased humidity in our treatment rooms, but let's make sure that we have our game up on the ventilation. So again, how do we remove the virus? The dynamics of the virus in the air mostly are, a lot of it will settle. We need to improve our game on the ventilation. And of course, some of the virus will be inactivated. And that depends on humidity. And so that is something that's really important for us to do. Now, at this time, when I give this little thing to my friends, they say, well, I now want to know whether or not this virus is active. How do I know that I'm just not dealing with dead virus, so I don't really have to worry about it? Well, guess what? The half-life of the virus is 1.1 hours at 65% relative humidity. And if it's aerosol-based, which it is, it's going to survive up to 16 hours at 54% relative humidity. So we need to make sure that we're removing this virus. So how do we focus on removing that virus? And that is through ventilation and good environmental controls. So the way we do that is we basically act as responsible dentists, and we've basically increased what we're doing in our offices. So here we go. Here's a hierarchy of controls. I'm of course guilty of this. When I first heard about everything, the first thing that came to me was my PPE, which is really important. So my PPE is so important. I'm making sure that I have gowns for the office. I'm making sure that I change my gowns between patients. I have my face shield. I'm wearing my N95 or a level 3 surgical mask. Done. Next thing, which is also most important that all of us have also done, we've got the pre-visit screening for COVID-19. Once the patient's done, we're also making sure we're cleaning, we're disinfecting, we're making sure that our places have never been so clean. And we've also eliminated our waiting room. We're eliminated all the things that we need to do. So from a perspective of engineering controls, a lot of us also put doors in our treatment rooms. We purchased air purifiers. We're using high volume suction. We're using rubber dam. A lot of my friends called me and said, Dil, you've always used rubber dam. I've never used one. I'm trying. You know what? It's awesome. Keep it up. And of course, all of us use a pre-op rinse. So basically, we're all where we need to be with this. And of course, we're all worried about the fallow time, because fallow time is what makes us, as dentists, being able to seat the next patient. So fallow time, we're all worried about that. And what we're doing is we're basically worrying about the air changes per hour. So before the pandemic started, we basically started with only emergency dental care. And we were also told to postpone routine dental procedures. I don't think that's being done. Everyone is basically going out there, they're drilling, and they're basically using, they're basically doing aerosol generating procedures. And for me, as a dentist, and I'm practicing, I didn't want to get started without a negative air isolation room or a air scrubber in my operatory. And for me, this is the most effective way to ensure safety for myself, my staff, and my patients, and more importantly, for my family. So I don't know why, as dentists, we're not focusing on negative air pressure for our rooms. So this is one of my pitches today that, again, I love this slide. This is how close we are to our patients. And we basically need to make sure that we're keeping everything great. So the other thing I want to make sure we all understand is, as dentists, we're also increasing the bioaerosol contaminants in our room. So what is the most important thing that we need to worry about? We need to worry about the direction of the airflow, not the CFM, but the direction of the airflow. Are we going from clean to less clean? And of course, the last thing and the most important thing is, are we in a closed system? Are we contaminating the whole dental office? Are we contaminating the hallway? Are we contaminating the room next door? Are we contaminating the reception area? Are we contaminating where we eat lunch? So these are things that we really need to make sure that we're taking care of. They're easy to do, and I hope, so hopefully people do that. So the main things we're really focusing on as dentists were the air purifiers. Very few people have come and talked about negative air units or air scrubbers. And I know this is something that is really important. And for me, I really like us to change the game on that. So a lot of my friends bought the air purifiers. And here's the thing about air purifiers. We always talked about increasing, what's my CFM on that? The higher the CFM, the quickly we can make sure that we're following our college's guidelines, and the quicker then we can get our patients in and out of the rooms. The problem with the higher CFM is all it's doing is there's no direction of airflow. You're basically contaminating the room with clean and contaminated room, as everything's been whirled around, is the best way that I can say. Some people have doors, some people don't have doors. And here's the worst thing. We don't or haven't even looked at our intake, the HVAC system. What's going on with that? So by putting in an air purifier, closing the door, and leaving that intake valve of the HVAC system, guess what we've done? We've actually created a positive pressure to a certain degree in that room. You're basically now forcing this air into that HVAC system, into the rest of the dental operatory. It's really not an effective way to make sure that the virus is being contained. So the other thing also, and this is something that the Ministry of Ontario had released in 2005 after the SARS, if you're calculating fallow time with an air purifier, you need to have a factor of 1.5. So that is something that's really, really important for us to understand. So the last thing, and very easy thing for us to do, is to make sure that we have a door. A lot of us don't have doors, so it's really important, whether you're doing anything, to have a door. So a lot of my friends bought air purifiers and they had a door. And I'm sitting there and and I do apologize, but I'm sitting there and I'm like, why would you want to really do that? Because what you're doing as a dentist now is you're closing the door, you've created positive pressure. If you weren't gonna be safe, guess what you're doing? You're basically now in a really less safe room. You're increasing the contamination of that room. And now you're basically churning and swirling clean air and dirty air together, and you're breathing it now. So I don't think that's a safe way to go. If you are still stuck with having an air purifier in your room, at least close the vent. It's a very simple thing that you can do, and you can just take that up. So that's kind of what I was going to mention about, and this is just a slide saying that The last thing also, with the increase of the CFM, you're also letting the air not settle. So that's another thing. You're constantly moving the air around, and this increases our biological risk and our exposure to everything. So for me, the air purifier really is not a very good alternative to making sure that you have good ventilation in your dental office. So I'll go back to using negative air units or air scrubbers in our dental offices. And again, hopefully I was speaking to Sharky about this, and we had a call before this, and I'm hoping this opens up the conversation to negative air. Regardless of who, where, whatever that you purchase, it's really important for us to discuss. And I think this is the future of what dental operatories, dental offices are going to be. We're going to have a negative air unit in our operatories, and we're going to need to make sure that all our rooms are closed systems, and that we're making sure that the aerosol is being cleaned in that operatory. So with the negative air, we do have a direction of airflow, and it is a closed system. And to quickly summarize, I'm going to go through each detail. The air is filtered in a medical grade HEPA filter, and it can be either recirculated outside the treatment room, or it can be circulated to outside fresh air. The beauty about negative air, it can be affordable. It's an easy installation, and most of the time we're able to retrofit into existing dental operatories. So let's talk a little bit more about that. So this is my office, and basically you can see this is how we installed the negative air in that unit. And this is pretty much how dirty or clean the air is in my operatory when I just put some smoke in the room. And you can see the smoke lingering. It's not going anywhere, okay? It stays. Imagine if somebody is positive or you have an asymptomatic patient and you're generating a contaminant with an aerosol generating procedure. It is lingering everywhere. And to me, not having a negative air pressure room, not having an airflow really doesn't make sense to me. Putting in an air purifier, and now what you're doing is you're just churning all this clean and less clean air together. So the first thing is, obviously, we have a pressure differential. So the tissue test is a really good way of making sure, and it's a really good explanation for me to help you understand you're having clean air from the hallway entering the operatory. So that's one thing that we have. We have basically a room directional patterned airflow. The next thing that we do is here's a great test. We have a pressure differential. So all that means is we're drawing air from the hallway, clean air, and we're putting it into our room. And that's the pressure differential that you see. And by guidelines, you're looking at about a 2.5 Pascal differentiation between the outside and the operatory. In terms of air changes per hour, and I know everyone's really interested in that. Again, it's the fallow time, and I completely get it. We have, from Protect Air, 3 models. I'm sorry about that typo there. We have one that has 350 CFM. We have one that has 660 CFM, and we currently have those in stock. So the way that works is we're now getting clean air from outside the operatory. It's going to go through the negative air or the air scrubber, get clean, and then it's going to be basically get transported out of the room. So because it's being transported out of the room, it can go into the plenum of the ceiling, it can go outside, it can go anywhere that you want us to do that for you. I find in my operatory, what I did was I basically just have it going into the plenum. Now, again, this is one thing that a lot of people get really hung up on, and I don't know why. So an air purifier, what it's doing is basically cleaning the room inside your operatory, and you're mixing clean and dirty clean air together. With the negative air unit, you're taking clean and dirty air, you're having your airflow, and you're cleaning that, and you're directing that airflow, clean air, into your ceiling plenum. So this is the way to go. And for our units, we're using a HEPA filter, and that's basically a quick little diagrammatic representation of what's happening inside that unit. Now, all our units are made in Canada, and this is just a really quick thing that I think all of us should have, is a particle counter. How much particles, which are less than 0.3 micrometers, are you inhaling all these years that we've been working as dentists? When I got that, I was just shocked as the amount of contaminants we're generating. So that's really important for us to have. So that's, once again, I think this is the future of us as to what we're doing and how we're going to be able to treat our patients. So in my opinion, and I think it's a good one, and I'm hopefully making a good point today, negative room pressure basically has been used. It's a gold standard. It's been used in hospitals throughout, it's a gold standard for how many years. And what it is basically it's creating a negative pressure that allows air from the outside hallway to go into our treatment rooms and then escape our room. This technique is used for anything that's airborne and contagious, such as TB, measles, chickenpox. Guess what? SARS, COVID-19, is an infectious, airborne, contagious disease. And there is no reason why we should not be using negative air for dental offices. So, again, what's next? And here is something that is an important thing for us to all understand and realize what's going on. For me, when COVID started, I'm like, okay, great. It's going to take us 6 months, a year. And now you're looking at, it may be going on till 2025. So you're looking at, quick math, you're looking at a lot of number of years ahead for us. And again, I'll make this point again. As a dentist, one of the things I learned today, which was the most important thing ever, is if we carry on our aerosol generating procedures, if we're carrying on working on our patients, obviously with their mouths open, this is our behavior, which we can't not do without, because we are dentists. We are very close to our patients. It's really high risk. It is just a matter of time and I'm hoping it does not happen, but it's a matter of time that we're going to get more COVID positive patient dentists. So it's important that we have good environmental controls to do that. And that's something that's really important. I hope today I've kind of explained to you. I know I've been repetitive, but it bears in mind how important this is, that we really take a really hard look at what we're doing in our office and whether it's good enough for us to do that. So a little bit about us and Protect Air. Visit our showroom anytime by appointment. This is the negative air unit that we have here. We also deal with filtration and UV units as well. And this is a quick little video that we've made for our patients.
Is this supposed to be sound?
Yes. Is there sound not coming?
No, the sound's not coming through.
Okay, no worries. I'll keep going. Thanks, Sharky, for letting me know.
Why don't you just give a link? Is it on YouTube?
Yep, it's on YouTube. I'll give a link in the chat, actually. I'll do that later if that's okay with you. You can actually go to the Protect Air now. We have a YouTube channel, and you can go there.
Okay, you can continue now. I'll load it up for you. Okay,
perfect. Thanks, Sharky. So some of the other things that we do, that we also do carry air purifiers. This is our new unit that we're having in stock. It's actually on our way here. We'll have it in stock in November 30th of end of this year. The other thing that I also want to focus on is upper room UVGI, and lastly but not least, the UV disinfection. So let me talk a little bit about upper room UVGI. So, actually I'll talk about UV disinfection first. So one of the big things about, a lot of the air purifiers out there is they have UV light in their units. And the really important thing for us all to understand is the air, because we're so worried about having a high CFM, so we are decreasing our fallow time, so we can see our next patient, that UV in your air purifier is doing nothing because the air is moving so quickly through it. Yes, the HEPA filter is working, but more importantly, there's nothing being done with the UV. This unit is fabulous. I have one actually two of them in my house, because I think it's so important to constantly filter the air that you're breathing. So it's very simple. And here it is. It's slow moving air. And by it moving slow, you're looking at about anywhere from 70 to even lower or higher, depending on the model that you want, of the air moving through the UV light. It also has these titanium oxide plates, and they can also basically are disinfecting the air. So it's really one of those things that I actually have added to my dental office just to continually clean the air. And I run that in my dental office 24/7. I also run it in my house 24/7. And I basically put that into the entrance of our house. So that's probably going to be where most of the infection area can occur. So that's one of the things that I absolutely got here by accident, which was completely phenomenal for us to have. And the upper room UVGI, now that I have the right slide, and that's something that is also tried, true, and proven. And we actually have these units in stock. And basically what it's doing is it's basically irradiating the upper 2 meters of your room. And that's basically trying to make sure, because COVID-19 is aerosol based, it's going to kill that top 2 layers of area if you don't want to, for instance, looking at getting into a negative air, or you want to keep pursuing and using your air purifier. So that's pretty much it. Sharky, I think I'm at 8 minutes, so I'm at 32 minutes. So hopefully I went as slow as I could. And that's pretty much it. And that's where we are now.
Perfect. Thanks very much for that.
Great.
Let's see here. Yeah, that's very informative. So everyone that's watching, you can post your questions on Facebook, on LinkedIn, and YouTube. And anyone here in the webinar, please post your questions in the comment section here, and then we can pass it off to Dr. Dil Hirji. So I have to have some questions myself.
Sure, absolutely.
You're covering that. So what is your view, based on the information that you have, based on the research, like what was your view on what would likely happen with COVID, and how do you think us as a society would kind of handle the situation going forward?
Absolutely. What I'll do actually is, and I should have actually, because I was looking at the time, I didn't want to be over. I'm actually going to go back. Can you see my screen right now?
Yep.
Okay, perfect. I'm actually going to go back to a few slides back, because I actually have that question answered. And, when I speak or anything else like that, I like to make sure that I have some kind of a research behind us. So basically you're asking us, are we in their second wave? What's going on? First of all, if you look at this, and this is a very great article that I read in Nature, we're really going to be very seasonal with our outbreaks. We're going to get an outbreak and it's going to die down. It's going to go back again. One of the really great things that I read is there's a certain temperature from 5 degrees to 15 degrees that COVID-19 really likes. So if anything that you're doing in terms of keeping your house, your dental office, or whatever else the case may be, avoid that temperature range. And that's one of the things that we can do, I think, as a society, is to just be more responsible, because I don't think this thing is going away, Sharky. I think it's going to be here with us for a very long time, unless, of course, we do get a vaccine. And what's going to happen is, unfortunately, with COVID-19, we're not getting lasting immunity. So if you look at that top chart there, if the immunity lasts about 40 weeks, you're going to get reinfected again. And if it lasts 100 weeks, then you're going to get an outbreak every other year. And once, hopefully, we do get something, hopefully with cross immunity, apparent elimination, and then we're slowly going to get these slow waves that have more and more time in between. And, scientists are estimating that we're going to have this with us for 2024 or 2025. So this is why I hopefully made my pitch about the ventilation in the dental office. If it's not now, you're going to need it. And once you have it, I honestly, once this dies down, we've been really negligent about the aerosol in the dental offices. We've always known it's been there. And we've kind of, to this day, they're always, and everyone will keep telling you, there's no known transmission of anything in the dental office. Well, you know, the last time we spoke, there were actually 8 or 9 dentists in, I think it was Italy, that actually did get infected. We've also gotten a few dentists in the States that have unfortunately have died. And, you know, this is not something that I really think we should be, as some of my friends say, I'm fine. I haven't got it yet. I'm good. The thing is, even if you get it, if you have a mild case, this thing is going to be at you for a long time. You've got something, you know, COVID-19. I don't want to discuss this because everyone knows these, but COVID-19 is not a disease that you really want to catch because there's so much unknown about it, Sharky.
Okay.
And hopefully I answered your question.
I think someone answered the question.
Okay, perfect. I said why a question to answer, and I wanted to base it on, you know, this chart.
So the chart shows that it would go all the way up to 2025. Yeah. What's the logic between for that?
Well, the logic for that is you can get reinfected. Mm-hmm. So basically what's happening is if you look at the top chart, and I'll just kind of, I don't know if you can. If you look at the top chart, you're looking at if immunity lasts about 40 weeks, and you're going to get, because, you know, in the winter time, you're going to get more of an outbreak. And so basically you're looking at outbreaks occurring every time as we go down to winter, because everyone's indoor, there's more chances of it happening. Mm-hmm. If the immunity lasts about 100 weeks, then you're looking at being more seasonal, right? You're looking at initial peak, which you've had, and then you're looking at outbreaks being more, there's a longer time between outbreaks. Mm. So this thing is not going away only because we're going to get reinfected. The other thing also, the virus is also mutating. So you can get one kind of a mutation and be infected with it, and then you're going to hopefully get a little bit of immunity. But in almost, I think there's been about 24 cases where people have had, and I don't know the percentage, but people actually had worse disease, and some people had less worse disease. So that's how we're looking at it being with us for a long time.
And then what's going to happen for it to stop in 2025?
I think what's going to happen is we're going to get our immunity. We're going to be, other viruses hopefully are getting a little bit of a cross immunity, maybe getting a vaccine. You know, I don't think there's something called herd immunity. I mean, what I've read, I don't think that's how it's going to work with COVID.
And then, so how does each of these scenarios affect the dentist?
Well, this is one of the things that I learned as I was doing this presentation is I really didn't understand that as a dentist, the more I am being a dentist, which means I'm actually seeing patients with their mouths open and I'm doing what I need to do to be a dentist, which is to work and drill, I'm increasing my exposure to me getting this disease. And for dentists, it's really important for us to make sure that our PPE, our staff behavior, our behavior is really, really being taken care of and looked at. And also good filtration. The thing with everything that we're doing in terms of wearing a mask, wearing a face shield, wearing gowns, we're doing nothing to eliminate the source of contamination. The only way you can eliminate that source of contamination is with a HEPA filter. You can use an air purifier, but I think that's really I don't like that approach very well, is to use a negative air. You're taking that contaminated air, you're cleaning it, and you're basically putting it elsewhere. And that's the only way that we can make sure that hopefully we're here till 2024, healthy and, helping our patients and contributing to society. Sharky? No. Hi, Sharky? I think Sharky's not here anymore. Hi, Sharky? Hey, Sharky, I don't know. I think it was you this time. It wasn't me.
Yeah, I'm still here.
Okay, perfect.
Yeah. Um, yeah, just kind of got disconnected for a second there. We're seeing a new upgrade in our
No
webinar
worries.
software.
I just want to make sure it wasn't me, because last time I know we were disconnected. It took me a little while to realize that. So I'm making sure I've got you on 3 things this time around. So
Perfect. And then from your experience, what's the best way to communicate to staff to make them feel safe? Because one of the biggest questions that I get from dentists is about how concerned the staff is in coming back. It's really
absolutely.
difficult in getting new staff, right?
Yeah.
Especially during this time. So what from your experience, what do you think is the best way to communicate to make them feel safe?
I honestly think, and I've been blessed. I've been lucky. Like, as you know, I have a dental office. I have great staff, and when I first told them about negative air, they really didn't get it, and it was a matter of, they didn't understand how critical it would be for us to make sure that we actually had an airflow. Once they realized what was going on and how safe we were, making sure that the air is taken care of. I've got my little particle counter. I'm measuring it. I'm making sure that, we're clean air. I'm making sure that we have a filtration. And once I got them to understand that, I think they really feel safe in the office. And I also have an associate that I work with. Same thing again. They feel that, a common concern that they have is, when I come work here, I feel safe, because it truly feels better. And here's one of the things that I love with all the PPE that we wear. It gets really hot, Sharky. I know you haven't been with all that gear, but with the negative air, because you have that airflow, it's cool. It's nice to work in. You don't have those, sweat trickling down the back of your gown as you're working, right? It's comfortable, and it's good working in.
Okay, that's good to know. And so can you discuss a bit about the different options? So the units that you show us, can you discuss about different, like, other units and the cost between these different units? I think so. One of the things that I heard from one of my clients is about the investment in the unit.
Sure.
Because there was earlier on, and some of the this one dentist thought that it would be over soon, and they say, well, does it make sense to invest in something like this? And I'm not sure if we get this kind of comment as well. Well, it doesn't make sense to invest in something like this. It'll be gone. We'll have the vaccine, like Trump said, by November, and then it can be fine for Christmas, right? But I think it's clear that it's not going to be. So maybe talk about different options that dentists would have in purifying their air.
Yeah, absolutely. You know what? I have, can you see my screen there, Sharky? I just want to make sure. Okay, perfect. Yeah. So basically, these are really the 4 units that we have going with us. And I think when we last spoke, we had a different unit, but we've kind of just really geared down and trying to offer the best possible solutions for dentists.
The investment in the unit.
Sure.
Because there was earlier on, and some of the this one dentist thought that it would be over soon, and they say, well, does it make sense to invest in something like this? And I'm not sure if we get this kind of comment as well. Well, it doesn't make sense to invest in something like this. It'll be gone. We'll have the vaccine, like Trump said, by November, and then it can be fine for Christmas, right? But I think it's clear that it's not going to be. So maybe talk about different options that dentists would have in purifying their air.
Yeah, absolutely. You know what? I have, can you see my screen there, Sharky? I just want to make sure. Okay, perfect. So basically, these are really the 4 units that we have going with us. And I think when we last spoke, we had a different unit, but we've kind of just really geared down and trying to offer the best possible solutions for dentists. So the first thing that I can tell you is doing all the things that I do as a dentist. I get to talk to a lot of dentists, a lot of staff out there. And there's a really big misconception that I can buy an air purifier, and I hope I don't upset people. Well, actually, I don't care if I upset you, because if you end up getting a better HEPA filtration for your office and your staff, then you know what? I did something good today. You really need to make sure that you have a very high HEPA filtration, at least HEPA 13 in your air purifier. You don't have to buy ours. It doesn't make a difference, but you really need to make sure that it's a HEPA 13. So a HEPA 13 filter, what it'll do is it'll make sure that it is cleaning the air effectively. It's stopping and cleaning the air. So that's the first thing that's important. The negative air scrubbers that we have are made in Canada, and they are HEPA 13, and they have a MERV rating of 18. So if you look at, if you're in a hospital and you're going into getting surgery, they're going to be in an air room or a negative air room, and they're going to be using very similar things. It's a hospital grade unit. They're using a HEPA 13, and they're going to be using a MERV of 18 or above. So that's the first thing I always advise people. Getting a air purifier from Costco, I bought it and I returned it once I realized what I was doing, because you're basically not stopping anything. What you're doing is you're collecting dust, and you're collecting dust in your air purifier. You're not purifying your air from the virus. And that's something that's really, really important. So in terms of a cost perspective, you can get relatively inexpensive purifiers anywhere from, and they're not our product, anywhere from $700, $800 and above. In terms of cost for the negative air, if you're looking at what I think is going to happen is there's a lot of uncertainty going on right now, but once the regulations and our colleges and everything gets their act together, because right now the guidelines that they're giving us are incorrect, they're wrong, and once they get their act together, I don't think there's going back. We're always going to be, well, COVID happened, SARS happened. When's the next thing going? What are you doing for your air? You have a problem with your air as a dentist. So why not start, and for more than anything, why not just do it for your own health and get something that filters properly? Okay. So get a HEPA 13, get a MERV 18 for a dental office. That's the first thing that I would do. Our negative air units are not that expensive. You're looking at, and the units being anywhere from $3,000 to about $5,000. The Protect Air Edge, you're looking at about $1,500 for that. And the upper room UVGI and the UV disinfection, we just got them. So we're basically just going through getting them all CSA approved. And so we're just going to be finalizing costs on them. But you're probably looking at about anywhere from $800 to about $1,200 for those units. And again, I don't think it's inexpensive. In all the different things that I bought for my dental office, that's good for my health going now and going forward. One of the things as a dentist I have or I don't have is a sense of smell. As a dentist, Sharky, I was in the trenches. I worked 10, 12-hour days, 3.5 days a week since 1993 when I first graduated. So I've been at this for, over 26, 27 years, Sharky, and I don't have a sense of smell. And the reason I don't have a sense of smell is because I've been breathing in dust all this time. And, this is something, after COVID, now that you know that you're breathing in all the dust that you're generating in the aerosol, what is the aerosol made of? The aerosol is made of viruses, is made up of tooth fragments, is made up of restorative material that you're drilling out, is made up of bugs, bacteria, toxin. You're breathing that in. I've been breathing that in for the last 30 years, and I don't want to go back. So in terms of upkeep, our negative air scrubbers, they're made to last. The only thing you're looking at in terms of upkeep is once a year or every 5 years, depending on how well you want to make sure that your HEPA is working. Get a new one. You're looking at $250 for that. That's your upkeep. These units don't go down. They're made they're made not to go down. They're made to last for a long time. So that's the investment that you're looking at. I think for your health past COVID is something that you really need to focus on.
No, I agree 100%.
Yeah.
With COVID, it really have drawn our attention to viruses.
Yeah.
Even the flu. Everyone,
Yep.
even myself, have better understanding of
Yep.
how to protect myself, not even just from COVID, but from other diseases
Yep.
and viruses as well. So we're a lot more aware of this. And our flu season, if we took all these procedures that we're doing now, our flu season would have been a lot easier if we all did that. So I agree 100%. It's going
Yep.
to absolutely change, and we're not going back. So I think it is a good investment, either in your unit or any other unit
Yeah.
for the long term. You don't want to buy something that's disposable like a Costco.
You know what? There's no problem with those Costco units. It's just the HEPA doesn't work. It's the HEPA. I think first of all, you have to find out what HEPA rating they have. If it's a HEPA 7 or HEPA 8, it's like your vacuum. It's the same. You're basically just putting your air through the vacuum. Don't buy the unit. Just turn your vacuum on, because that's really what you're doing, right?
Yeah. Great. Do we have any more questions? We're running out of time. So just come to the last thing. Are there any general questions that you get from dentists or other people in the industry that you haven't covered yet?
You know what? I don't get questions, but I get a false sense of security with a lot of my friends, and because I guess I'm biased. I am trying to sell these units. I don't push it. I'll be very honest with you. But they have a false sense of security. Nothing's happened to me. Nothing's going to happen. I'm fine, right? But honestly, my curing light cost me $2,000. You know what I mean? It's not something that we need to spend. We need to protect ourselves as a dentist, because it's a high risk, and hopefully I've made that clear how high risk we are, right? It's not something that you can just say, okay, I'm fine, I'm okay, I'm following the regulations, I'm following the guidelines. The guidelines are wrong. They're based on droplet transmission. This is not droplet transmission, it's aerosol. And there's got to be a lot of things that you have to hold true to yourself. So that's my biggest thing going forward is I hope people realize this. It's not an inexpensive thing to do. Just get a good HEPA filter in your air purifier or negative air if that's what you want to do.
Perfect. Thank you very much.
My pleasure. Thank you, Sharky.
So coming up on Wednesday, November the 11th, next week, we have Dr. Natalie Archer and Joan Hutchings. They will be talking about preparing and training your practice and team for health inspectors and labor board audits. Will you pass? So that's a very important topic. I know there's a lot of things for dental offices to take care of, but you don't want to be in a situation where a health inspector comes and you're not prepared. So just tune in for 1 hour, and then you can help you apply different techniques, best practices, so that you will be prepared. And then on November the 18th, we have Dr. Herji back again with a couple of other speakers from the industry on the future challenges in the dental industry, how to prepare and position your practice to succeed in 2021. A lot of things have changed. A lot of things have stayed the same. What you need to do to prepare and succeed in 2021. It's a great time right now to think ahead and better prepare yourself to having great success in 2021. Things are changing, and it's best to improve your practice management. Other areas you should be thinking about, finance, accounting. Tune in on Wednesday, November the 18th, where we have a panel discussion on the main topics that are important to dentists going forward. And here is my contact if you want to reach out to me about the webinars or about marketing for your dental office. Sharky.lu@dentistfind.com. And we have the contact for Dr. Herji here as well. Thank you very much, everyone. And to register, go to dentistrybusiness.com. Check out upcoming webinars, as well as you can watch on demand any relevant topics from our previous webinars. Thank you.
Thank you, Sharky.
Thanks, everyone.